Right now, Louisville's nursing community is facing a crisis, under attack while on the job. Since March, police have been called to 3 different Louisville hospitals after a nurse was assaulted. And we're learning those are just the attacks that have been reported. Healthcare workers tell us they face dangerous situations daily and often without the support they say they need.
911, operator Canal, where's your emergency?
I'm security at Jewish Hospital. We just had a lady stabbed.
And who did she stab?
She stabbed a nurse that was getting off work. It was unprovoked.
It was shift change on Saturday, April 12th, right around 7 in the morning. 911 dispatchers sent police to find a suspect running from Jewish Hospital in downtown Louisville.
The callers advised a black female, black clothing, going westbound on Chestnut had stabbed a nurse that was getting off work.
1 month earlier, another incident, this time at Peace Hospital on Newburgh Road.
They're hurting us. Please send them. Please send them.
Yes.
A fight broke out between patients.
No! Get out!
That's one of the patients. Banging. He's banging on the wall at the nurse's station. I'm not sure how many nurses are hurt.
Do you have other staff out there that are
Yes, but there's not enough of us. There's not enough.
And most recently, on the 3rd floor of U of L Hospital in downtown Louisville, arrest records describe a terrifying attack. A nurse choked, slammed to the ground, and hit. The patient later telling police she was mad because staff was taking too long to discharge her.
Patients just become violent, and sometimes it can be from out of nowhere. Sometimes you can see the frustration coming, and sometimes it's just random.
These 3 incidents of violence against nurses sit on a map of hundreds of crimes reported at or near Louisville hospitals and nearby parking garages over the last year. According to LMPD's crime data portal, in Louisville's downtown medical district, 17 assaults were reported at Norton Hospital, 10 at Jewish Hospital, and 28 at the U of L Hospital parking garage. At Norton Audubon Hospital, there have been 10 assaults, and east of that, at U of L Peace Hospital, 19. And in South Louisville, at U of L Mary and Elizabeth, 6 assaults reported in the last 12 months.
I've been hit, punched, kicked.
I've had things thrown at me. I've also been punched as well.
They hit, they scream, they bite.
Most physical attacks come from patients. Verbal assaults or abuse is typically from family members or visitors.
We put a call out on social media asking local nurses if they feel safe on the job. More than 50 healthcare workers responded, answering blatantly, no, they don't feel safe. 4 agreed to sit down and tell us about their experiences, identifying themselves as employees at U of L Health, Norton, and Baptist. They asked us not to show their faces or names in fear of losing their jobs.
I think that there needs to be a really big shift in the culture and the treatment around healthcare workers, specifically the ones that spend so much time with patients and at the bedside, nurses and techs. Because it is concerning.
Concerning from the top down. They say hospital administration doesn't understand the dangers in healthcare today, proven by ineffective training, one nurse said.
We're kind of like trained if we're in the situation, how to get out of it.
Is that something you imagined when you thought about going into healthcare, that you'd be learning about how to physically escape an attack?
Oh, definitely not. And I've definitely never used any of those skills. By the time I need to use those skills, I mean, I've already been assaulted, so I definitely don't have time to think about how to get into like a certain stance.
Another pointed to a lack of accountability after an attack.
We need consequences for these sorts of actions. Filling out an incident report is time consuming and nothing ever comes of it. Something should come of it.
There's also a sign that they've put at a lot of the U of L health facilities, just kind of letting people know that we don't tolerate violence.
So those signs, would you say, are not true?
I don't think that it's true, because I mean, we do tolerate violence for sure.
And they say staffing, the major nurse shortage, escalates everything.
When you're short-staffed, everybody's stretched thinner and trying to make more of what they have and with their time. And it makes it harder because you don't have the manpower there to have watchful eyes to help de-escalate situations.
We reached out to the 3 major hospital groups in our area, asking for a response to the allegations. Norton Healthcare said in part, physical violence, emotional abuse, lewd and or intimidating behavior toward healthcare employees is never acceptable, and Norton Healthcare does not tolerate it under any circumstance. Baptist Health said in part, there are serious concerns about workplace violence in the healthcare industry. Baptist Health is committed to protecting the safety of our staff, patients, and visitors. And U of L Health said in part, safety on our campuses is always a top priority for our staff, our patients, and visitors. In addition to positioning our security team in high-trafficked areas, escorts are also available for anyone upon request. But for the men and women working in the halls of our hospitals, it's not enough.
With this level of violence, I don't think this is a sustainable career.
We got multiple staff members injured. We need police.
You're going to lose a lot of your experience because a lot of your experienced nurses and staff are going to leave because they're going to get tired of it.
In 2023, lawmakers passed a law meant to protect healthcare workers and force healthcare groups to record incidents of violence and make adjustments so they don't happen again. But the Kentucky Nurses Association tells us the law isn't helping at all. In part 2 of this story, the push to remedy the failed legislation and one healthcare group taking it into their own hands.
I have some ACE bandages. I have a blood pressure cuff, stethoscope.
For a home health nurse, the supply closet looks a little bit different.
Yes, just depending on what each patient needs is what you put in your bag.
And for Donna Beld, being prepared isn't just what she puts in her bag.
Every time we go in somewhere, we kind of scout the area first, the home, watch for safety, red flags, that type of thing. But once you get on the other side of the door, you never quite know what you're going to see or find.
Safety is top of mind when she's on the job, oftentimes alone. Now, a new technology is giving her a sense of support.
They have an app where I can ask them to walk with me. I can do a panic button, and then there's a silent way to alarm also.
It's called Katana, a personal safety device that attaches directly to a smartphone. Hosperis Health has been testing the technology for the last several weeks with select nurses before deploying it to the entire team later this month.
I think our ultimate hope is that our care providers feel more safe, more secure, know that they have a lot of options if they do feel unsafe, and that gives them the peace of mind so that they can focus on providing the great care that we know that they're able to provide and not focus on the safety piece of it.
The decision to invest in a new safety option is timely as healthcare workers across our area sound the alarm.
How many nurses are hurt? I'm on the phone with 911.
In the last 3 months, police have responded to 3 assaults against nurses at Louisville hospitals, and those are just the incidents that are actually reported.
Many healthcare professionals that are harmed don't report it. And they don't report it because they don't think anybody will listen. And then there are others who think that it's part of the job. It is not part of the job.
In 2023, CEO of the Kentucky Nurses Association, Delanor Manson, worked with lawmakers to formalize language requiring healthcare facilities to track incidents of violence and implement violence prevention strategies.
I mean, we were dancing on the tables. That was great. But there were some amendments to it that made it pretty ineffective.
It's a crisis for this career field, Manson says. She's already working to combat an expected shortage of 20,000 nurses in Kentucky over the next 5 years. And workplace violence isn't exactly helping recruitment.
So now we have to go back to the drawing board because these situations are not going to stop because we wish that they would.
She says she's working with lawmakers once again to get the needed reforms put on paper and passed. But she also says she needs you.
This is important to every Kentuckian to be able to have a nurse. And if they quit, they decide they want to be in some other profession, then we will all suffer.
Because we all need nurses.
I get to be there. I get to help.
The compassionate frontline worker during our most vulnerable moments.
I get to hold their hand. Those are things that are just feel like an honor instead of a burden. So that's what keeps me positive.
We put a call out on social media asking local nurses if they feel safe on the job. More than 50 healthcare workers responded, answering blatantly, no, they don't, and sharing the reasons why. We included their stories in the online article. You can read it for yourself right now on WHAS11.com.